my work we focus on populations that have different vascular pathology degrees. And these individuals are underscored most of the time in clinical trials and also for new biomarkers to categorize this level of dementia. And in my case, I work with plasma GFAP, trying to see if we can use this biomarker as a proxy for detect vascular dementia in people that doesn't have amyloid burden, which is not actually most of the time integrated in the new therapies that we see nowadays in clinical trials. So I guess we are taking the first steps to include those populations to be investigating clinical trials for new treatments. So I think this is one of the gaps that my research might be going towards to fill a little bit.
My work focuses on looking at plasma or blood biomarkers of Alzheimer's disease, where we can try and do prediction and early detection in a preclinical population. And sort of the short answer is what we found is there are many different assays from different companies on how to look at these blood biomarkers, but they all do equally well in predicting or differentiating people who may be positive for A-beta pathology in imaging versus negative. And so even though there are different companies and different assays, they're all doing as well when we're trying to find people who may have pathologies for Alzheimer's disease.
We start building hardware for MRI machines. So basically we have a 70 MRI, that is a stronger machine. And then we'll build these coils that produce beautiful images of the brain. We have high resolution, high quality images. And then we apply our hardware to many patient studies. And then this one study that we're doing is a MCI population. And then we did both the high resolution MRI and PET. And then we compared the groups between PIP positive and PIP negative in this population.
What are kind of the emotional impact of learning your amyloid PET scan result, your Alzheimer's disease biomarker results? So here we looked at patients, 75 participants, and 1 month following their disclosure of their biomarkers, what are kind of their emotional distress scores. So we found that participants who are cognitively normal have significantly lower level of emotional distress scores compared to participants who have mild cognitive impairment or those who have dementia. My research kind of shows possibly like what are some of the implications for counseling and support for participants who do have cognitive impairment and learning their biomarker results.
I work with microglia, and these cells are the lead cells in the pro-inflammatory disease response in the Alzheimer's disease. So that is very important because a very huge amount of treatments based pharmacological approaches are focused in microglia and trying to stop inflammation in the brain.
I've been working for a couple of years on that intersection between Alzheimer's disease and attention deficit hyperactivity disorder. So basically there has been recent data suggesting that individuals with ADHD or attention deficit hyperactivity disorder might be more likely to develop cognitive decline in older age, more specifically Alzheimer's disease. So I have been using different strategies to kind of trying to understand this association and the mechanisms behind it. More specifically, the work I'm presenting right now at the Alzheimer's Association conference is on the association between attention deficit hyperactivity disorder and neuropsychiatric symptoms in Alzheimer's disease.
We are interested in equipping nursing home staff with the tools and knowledge that they need to better care for our residents living with dementia. And we're going to be presenting on our pragmatic trial that we completed.
I feel very happy and I feel that I have now 3 years to really do what I envisioned for so many years, and to really discover something that will be impactful for the patients, that they may help in their diagnosis or to understand how the disease happens in their brains. So for me it's very important. I have been waiting for this for a long time.
That's wonderful. So tell me just a little bit more about your work and the impact that it could have.
So we are now trying to use blood biomarkers for detecting Alzheimer's disease. It's much cheaper and easier to access than the other biomarkers we have been trying to use, like imaging. And we started using one that comes from one specific cell of the brain, the astrocytes, but we don't know what we are seeing in the blood, how it reflects what's really happening in the brain. So I'm gonna use a lot of post-mortem brains of patients and their bloods to kind of try to bring these two things together and understand what we are seeing in the blood, what is actually happening in the brain. So we can understand the mechanisms of neurodegeneration and how the disease starts, because this is a biomarker in the start of the disease, but also to understand what it means when you have this biomarker on your blood and what it could change in your treatment or your disease course.
I think it is a really it's a step forward in my career. I start my postdoctoral researcher fellowship 9 months ago, and submit the proposal 2 times, and I got in the second time. In less than a year of a postdoc is incredible. And I could not do this without the team, my mentors, Tarek, Bruna. So I'm really happy to be part of this team, and also this fellowship will be amazing for me. We are trying to set a wet lab in the lab, and it will be great to answer some questions that I'm having since my PhD.
Okay, and can you talk a little bit more about the work that you were doing? How could it impact families, and how could this funding help?
Sure. My work, my background is in biochemistry, so in my PhD I study how hypercholesterolemia, which is high levels of cholesterol in the blood, can affect cognition. I was doing this in a preclinical set. I was working with mice, and now I'm trying to translate it to clinics. So I'm working with data sets, and in the proposal that I was funded from Alzheimer's Association, I'm willing to answer questions like how changes in cholesterol metabolism in the brain can affect microglia activity and how it's spreading throughout the brain. So this can be very important in the sense of for the community, in the sense people with hypercholesterolemia can have a better understanding about this risk factor for dementia. It's not just vascular risk. It's a vascular risk factor, of course, but it can be more than that. The mechanism underlying this is very, especially in human settings, is very difficult. And then we are trying to elucidate it better, and probably in the future we have some biomarker related to cholesterol metabolism and microglia activity, and it can help to early detection for Alzheimer's disease.